Motion to approve.
Okay, motion to approve, so the July minutes will be approved. We'll go right into new business. Shelley Arkwright is going to start off talking about the Enough initiative.
Thank you, Donna. Good morning, everybody. So this morning we have an exciting initiative to talk to you all about. It's called the Enough Initiative. It is from the Governor's Office for Children. Several months back, we spoke with you all about that a little bit with Fred's office. Lindsay Broadwater presented the information to you. And we're going to actually begin by letting the governor share his thoughts about it via video. So if you could just play that for us, I think he can explain it.
Yes, please.
Right, so that's pretty inspiring, right? And we've been able to essentially work with the RBA framework. That is a framework that helps communities understand and realize strategies. And Lindsay Broadwater and Fred's team went into each community in April. And that was really the first kind of discussions about this initiative. So the communities that have been identified through the governor's office are Kitzmiller, Bloomington, Grantsville, and Accident. And again, those are the communities that we were allowed to work with based on the data that the governor's office provided to us. So that is why we're in those communities from the governor's office. Next slide. So you heard it in the video, but that it was really important because they're really trying to, I'm just going to read the quote. This initiative recognizes that people who live in a community are best positioned to lead the change in that community. It puts funding and power directly in the hands of neighborhood organizations, not agencies or outsiders. And so it's very important for us to spend time going into these communities during focus groups and listening to what's already happening and how we can best come alongside them and help them continue to build on the initiatives that they're already doing. And so with the Enough initiative, Garrett County and the communities that they've identified were not eligible for any of the funding associated with this at this point. And so we're going in, listening and trying to come up with and leverage funds that we have and come up with no-cost strategies. And so we've been fairly successful. We'll get to that. But just to note that it is a slightly different approach, because it's not a prescriptive grant where they give you a bunch of money and tell you what you have to do. They really want you to build it from the ground up. Next slide. So they have 4 pillars, and everything kind of really just runs from those. High quality childcare and education is the first one. This is all about early care education from birth until working in a career. So, you know, think just that young K through 12, college and career, and then young moms. And then healthy families. That's encouraging community members and families, thanks, to assess high quality healthcare. There's an emphasis on decreasing infant mortality and increasing life expectancy and improving mental health. So there is a fairly substantial correlation between mental health and infant mortality, just to note. And then the other one is the economically secure families. And really they're focusing on the high rates of unemployment, living wage issues, stable and thriving households. They want that for just to build wealth and make sure families can make it in this economy. And then safe and thriving communities, that's our broadest. That's where residents feel safe and can thrive through high quality affordable housing and essentially a robust commercial core with access to recreation spaces, nutritious food, and transportation. So everywhere you want to live. You have an affordable place to live, you have a place to recreate, and you have good food. So those are the governor's pillars. And the goal at the top there is to just end childhood poverty and increase economic mobility in Maryland. No small task. And so at the bottom, it talks about strategies. And this is where we come alongside our communities and help them develop strategies that work towards these goals. Next slide. So the tangible result is a neighborhood action plan. And the goal of that, again, is just to reduce poverty. So the action plan, of course, will be on mygarrettcounty.com as soon as it's all realized. And the communities will have measures and be able to track their success over time. Next slide. So Bloomington was our first community development session in April. I call it data discovery. Fred's office, the local management board, and Lindsay Broadwater and the team contracted with someone who came in and took the community through the data and the RBA framework. Pretty intensive deep dive, and they came up with just different areas. They strategized, they talked about what would turn the curve. That is a just a question that you ask in that framework, like what's it going to take to move us? And so that happened in April, and then our unit, the population health unit, was tasked with providing technical assistance and helping communities actually get there. And we had, of course, refreshments at each of our meetings, and really had an amazing time. So I am going to invite Maggie up. She is from Bloomington. She's our community champion there. And she's going to talk a little bit about what's happening in Bloomington and how they're fitting into this initiative, or how we're fitting into what they're doing, actually, is a better way to say it. So thanks for coming up, Maggie, and talking a little bit about what's happening in Bloomington.
Good morning. My name is Maggie Roby. I know several of you. I am a member of the Bloomington Volunteer Fire Department and the president of the Bloomington Ladies Auxiliary. We were very blessed to have the meeting with the county. There are some really exciting things that are happening down in Bloomington now. we are actually tonight have an event, which is going to be our backpack program. When we met with Shelley, one of the needs that we saw that was happening in our area was we have a lot of children and a lot of families that are in a lower income area. So one of the needs are school supplies for our children. So brainstorming, she came up with the idea of the backpack giveaway. This enables the children to receive a free backpack with school supplies, with snacks, with water bottles, jump ropes, things like that. So that is our event tonight from 5:30 to 7:30. She's allotted 100 backpacks to be given out. So this will be our test run to see how successful, and hopefully we're able to service a lot of the families in our area that really do need this program. Another service that we are going to do, another exciting project. We have worked with Sierra Wakefield for Garrett County. We applied for a grant through Green Space Equity Program and were allotted $275,000 for a new playground. Our playground is an old playground that has been there since I think 1970s, 1980s. We wanted to expand that and make that park accessible. It's open to the public. Anybody can use it and service it. But with that money, we have partnered with playground equipment specialists, and we are creating a new playground that is going to be the Bloomington Heroes Park revitalization. So it is going to theme around emergency medical responders. So in our playground, we will have little things like a fire truck. It will have a fire hat. We also are going to get new paving for our track, and along the paving routes are going to be exercise equipments that are stationary, or they are permanent fixtures that will be able to allow people with benches also. So it would allow our community to exercise and still watch your children play. And it's going to be just a good community gathering place. And we also have a pavilion, which is also free to the public to use. So we're hoping with this revitalization that we'll have more kids involved in the area. It will give them something to do. And we're really excited about our project. And it's hopefully going to be done the middle of November of this year. So we invite you all to come down and see it when it's completed.
Okay, great. All right, next slide, John. Thanks, Maggie. So this is another plug about Bloomington and the event we're having this evening. I just want to thank Kristen Coddington. She is brand new to our team. She's here. Wave, Kristen. She's coordinating all of the programming. So she got all those backpacks together, packed them all, and we're headed down there tonight. So I mentioned that there's no funding, right, with the Enough initiative. And so when we went down and talked to Maggie and learned about their program open space grant and all the events that they want to have, the infrastructure is provided through Sierra Wakefield and technical assistance there, but what else can we do? And so the backpack program is just the first step in building those relationships. It was the most immediate need that they felt the Rotary, other people are doing backpack programs all over the county. Bloomington doesn't have anyone servicing them for that piece. And so that was a gap that we could easily fill because we do have the Healthy Together funding. So that is through the CHCRC grant with AHEC West. Many of us in the room are partners on that grant. Our piece of that is chronic disease and food and nutrition security. And Melissa and Jennifer Hare said, okay, this fits. We put some healthy snacks in the backpack. We put some exercise stuff in there. We put water bottles, and we're going to try to just build on the relationships that we make this evening. And so all of our folks from Bloomington who come to get the backpack will be enrolled in our Healthy Together program on GoGarrettCountyPlus.com. And the idea is that we begin with that, with the kids who need help and their families, and then continue our presence in Bloomington. We're going to have another event at Bloomington Days. And as the park becomes the park and it's revitalized, we're going to have a lot more activities, chronic disease related, and it will be led by the folks at Bloomington. So examples could be walking clubs. We can have different classes and things like that. So this is brand new, and we don't have a lot more to show you as far as a full-on plan at this moment, but we certainly will be reporting back to share with you what's happening in Bloomington. So thank you for coming this morning. And the fire hall it's just so wonderful. You go down there, the door's open, you can set up, everyone comes in and says hi. And it is really just a really neat town. And they really do take care of one another. So the other thing that we're doing this time, which is a little unique, is that we didn't post on Go Garrett County Plus this time for this particular event. They wanted to try a grassroots approach to just getting the word out and kind of spreading it through the town and the surrounding networks that they have. And so it truly is community led, because John and I are like, let's get it out. Let's send it to everybody. And it's a neat way to really pause and just let the grassroots seed take hold, that kind of thing. So more to come. Next slide. So Grantsville, we started there. Again, same type of thing. Fred and his crew went out. The data discovery happened in April. And then Kristen and I, this is a picture that made it to Facebook somehow. That was our meeting, just our first technical assistance meeting in August. Grantsville is doing a lot of cool things. They, with the help of the county, just purchased a large church, and they are talking about plans and trying to figure out what they're going to do with that space. It needs a new roof. They want to put some childcare in there. They're working with a lot of different partners. And they also have a need for food security. And nutrition security. They have the Highlands thrift store there, and they have a lot of different things happening. And so we don't have a forward plan in place at this point. They really want to focus on trying to have some childcare. And so the governor's office just updated their website. John found it for us a couple days ago. And there could be more funding that is going to be released. The turnaround is really quick, as usual. September 15th is when the applications are due, but there's nothing to respond to yet. So we're ready to be able to see what happened there. So that's initially their goal. It'll be one or two of those things. It probably will fall into that category 4, which is the safe and thriving communities, or it could be the cradle to career, depending on what avenue that we can leverage and we think we'll be able to get the funding, because that's really how you have to do that kind of stuff. So next slide, accident and Kitzmiller are both coming up next week. So if you're available and as members of the Health Planning Council or interested citizens, you want to come down to Kitzmiller September 3rd, we'll do some technical assistance there, and then an accident the next night, September 4th. Again, those data sessions already happened in April. We did that all at the same time, and we gave people an opportunity to think about those things, talk about them at their town meetings, and try to develop some of their own plans before we came in to offer any technical assistance. So,
are these being held at the town council?
Yeah, so accident is at the town council of the town hall there, and then Kitzmiller is in, it's not associated with one of their meetings, I don't think. Is it, Kristen? I don't think so. I think it's a special meeting that they called. They weren't sure they were going to have time for us at their town council meeting. They have a lot on their agenda, but, and that'll be at the gathering, the community school. Can't remember the exact name of it, but the building, everything happens at it. So that's where that is. Any questions about the Enough Initiative or the working in the towns? Do you have anything to add, Fred, about RBA or your team?
I think Lindsay's with us, so she might have the ability to talk about some stuff as well, but results-based accountability is RBA. And so the good thing about it is when we went to Bloomington, all these different communities, we used some of the community health assessment questions. And there was a question like, what will make Bloomington a better place to live? And what are the priority areas for the Bloomington people? And where do you meet? And everyone told us, well, we meet here at the fire hall. And I said, you go. And it's the fire hall. That was it. So there's a church somewhere we're told about that could be used. We don't know for sure. Something's going on down there at a Methodist. Yeah, some church. But that could be used as well, maybe. So there are thoughts about that. So when you're going to the communities, the good thing is you hear, and Shelley mentioned this earlier, it's not about us being prescriptive at all. There's sometimes you have to have a framework to address things, and results-based accountability allows you to do that. Because you're asking, what does the population, what do we want to see as an outcome for the entire population, not just in the state of Maryland, and not just in Garrett County, but Bloomington, Accident, Kitzmiller, and Grantsville specifically. What do the residents of those communities want to see as outcomes that are going to help them thrive and meet any one of those four pillars, as well as, chronic disease, especially. There's a lot of junk happening with people right now. Who knows why? But there can be things implemented. And there can be low cost, as Shelley mentioned this, I think low cost or no cost initiatives that can take place. There's a lot of that happening in the community. People just don't know about it. There's stuff that can happen at the library. So we could expand partnerships with the library system, as long as you're not flooded anymore with heavy rains and drainage issues.
We're okay.
But that's good now. That's cool. And so there's a lot of stuff that can happen. We just have to make sure we're touching base with the right people. I think county government, Commissioner Tichenal, is going to be an extremely valuable partnership to maintain and have partnerships and support financial, hopefully, in some way with county government. And how can the county government contribute to the communities to allow some of this stuff to happen? When we went down in April, there were issues with the park or baseball field, I think, right? Because of regulations with grant funding, it makes it extremely challenging sometimes. So you have to find the right people to communicate to allow stuff like that to take place and become more formalized and not have to worry about all the silly regulations that exist with a federal grant versus project open space. And can you pave within 3 feet of a lily plant or something like that? Not to be discriminatory towards the plants, but they're good for deodorizing. I think I read that in an Instagram thing. But we just have to make sure that we have the right people at every meeting, and that's why we wanted to make sure. Shelley and John did a great job. I think Shelley was called all the town people and said, we want to present at the town council if we can, because we want to have the elected officials there to hear what your community is saying and what they want. Rather than keeping it up in the high level, we want to bring it down low. What's that $30,000 or $60,000 or not dollar, but 60,000 foot initiative? We want to bring it down to the ground level and have people that are living there every day. Bloomington was interesting because they referred to themselves as the forgotten community. We're the community at the bottom of the hill. And Mount Laurel was congratulated, even though you weren't at the meeting, because you have is it Midland? Where what's the clinic that you established? Western Ward. So that's where a lot of people go, so they don't have to come up the mountain to get a doctor's note for a sick child. They used to have to do that. That's what we heard. And it was they were loud, but appropriately loud. They were energetic. And they said, listen, tell people in Oakland, the commissioners and county government and all these officials, we are still here.
And I want to thank the county commissioners because they have always supported our community. And as far as like the grants that we're getting and the funding we're receiving funds from the county commissioners, a portion of it, some from the state to repave our track.
Yeah.
You know, anytime we've ever needed anything for the fire department, our county commissioners have supported us. They support us by coming to our annual banquet. Anytime we need anything, Senator Mike McKay has been a huge push for us and recognizing us and helping us to discover different grants to help us grow in our community. And with your help, we appreciate all of people recognizing us again and realizing, you know, we're not in Allegheny County. We are the very tip of Allegheny County, but we are Garrett County. So it's nice. When we lost the school, it was almost like you kind of lose your community sense. And it's nice that it's coming back together again. And hopefully with this new playground, people will come down to utilize it. It's going to be a beautiful park. People will be able to use it and realize we still do exist. So.
Anything else?
I don't have anything else. I think that was good. And we'll bring our other communities in as all of their plans are realized as well. So thank you. And then it's back to you.
Okay, we have short meeting today, so we're to the agenda item agency updates, and I'll start in the room first. Any updates, commissioners, anyone?
I don't have any updates, but I will say this, Maggie, thank you for your kind words. The Bloomington community has added on to their fire department. If you could go down and see what they have added on to that building. We have helped them some, but they have raised a lot of money to do this. And it just shows you how close-knit that community is down there. And they are part of Garrett County and they do exist. So again, thank you, Maggie.
To add on to that, we were able to add 3. Our space was very limited for the equipment that we have. We have a tanker, we have a mini pumper, we have, you know, a rescue team, we have swift water response team. So and we service Garrett County. We even help Allegheny County. We help Mineral County. We support different areas. We are also on standby that if say the Kitzmiller department has a large fire, we will assist, but we will also be on standby at other fire stations. With that being said, we have a large volunteer. We have on average at least 45 volunteer firefighters, at least. Active when we have 0 non-response calls. So for every time 911 puts a call out to our area that we're called out and dispatched, we have never, ever not had volunteers show up to meet the needs for the community, whether it be medical, whether it be a fire call, motor vehicle accident, which is a huge thing to say about volunteerism because it has really declined huge amount in the past several years. I understand people get busy, but we always have the volunteers and the support we need to be able to assist. We have added on a huge meeting room in the back of our building, 3 additional bays to house our equipment and our trucks. So it's exciting for us, and it's exciting that this, you know, commissioners and Mike McKay have helped make that possible. But a lot of it is funding from our fundraisers. We have cash bashes, things like that. And it's just nice to get the support from the community. So it's exciting to see that we're able to bless others from our blessings. So.
Anyone else? Jennifer?
Matt Laurel, just a little update on the pharmacy in Grantsville. So Walgreens, as we know, is closing up there, I think next week. They didn't coordinate their closing with our opening, but we will be probably doing a soft opening in the next week or so. We're waiting for licensing. And we have informed the town of Grantsville that it's coming. but we have to wait for licensing. So hopefully, very soon we'll be opening the pharmacy, which will fill the void up in Graysville.
Then I have one more thing. We have our Harvest Hub meal box program that's happening on Friday of this week. In the back of the room, we have, oh yeah, tomorrow is happening. That's all local food, wild ember, sourdough bread. It's going to be an amazing box. And we're serving 60 of those, and we have Harvest Hub cooler bags in the back that just came in the mail in the nick of time. And then we also have a canning program that we're doing through that grant, and that is going to be the same time as our accident enough initiative. So 5:30, you can go to the canning. I think there's 2 spots left, and then come over to accident and hang out with me and the rest of the town as we talk about the enough initiative. It's a late one. It's at 7. So a lot happening next week for just opportunities for being able to enjoy this last little bit of summer and all the good food that we have right now, and then learning how to preserve that. So
I do have a question. And your wife made me think this. Why is Prelin not as an underserved area?
So that is the governor's office. for
Okay.
children. It's not,
Because that is such, that's a community that is near and dear to me. My kids went to Prelin School, and that is an amazing school that I would put up against any school in Garrett County. But anyway, put that little plug in. But it just is a very underserved area that I think should have fallen in this category as well.
So Maggie, that was based on census tract data, and you had to have at least 30% of the underaging, 18 and under population
Okay.
in poverty. So that's one of the problems with census tract data. It doesn't capture these specific communities, smaller communities within like a larger zip code.
Okay.
So that's one of the dilemmas with that. So that's why they allowed us to utilize some adjacent towns to add on to the Enough initiative.
Okay.
But Oakland was not considered one of those, so we couldn't include Prelin, for example.
And that's what hurts, because you have Deer Park, you have Prelin, you have, all of these areas that fall under Mount Lake Park, Loch Lynn, that fall under Oakland, but it's not Oakland technically, so.
There's a hand up over there.
Okay, online, we have online.
I think Lindsay had
Oh.
a statement or question. Okay, yeah. Lindsay?
Lindsay?
Yeah, it was just my hand. I was just going to share what you shared, Fred. Thanks.
All right.
Anyone else online have a question or update to give? Alicia?
Good morning, everyone. Just a couple quick things from the Department of Social Services related to health and wellness. We are sponsoring a 2-day training for our staff it's called CE-CERT. It's a secondary trauma intensive training for those professionals who work in trauma-based, crisis-based fields. It addresses secondary trauma, burnout, et cetera. So we are still super busy in the child welfare side, dealing with lots of those types of issues. So I've begun to notice just some fatigue with staff, and we actually are reassigning some staff to give them a break in certain areas and things like that. So really looking inward to try to, support our staff in this work, obviously for recruitment and retention issues as well. The state of Maryland's under hiring freeze, so I don't want anyone to leave. Just really investing in our staff. And then the only second update is related to this group. You may have seen at the fair or around the community little signs that say, are you a kinship provider? Might you be a resource parent? Those are our signs, and that is going toward our headquarters, DHS's initiative around kinship providers versus the standardized old school resource or foster parenting. This concept is about, if we do a removal of a child, we now meet with that family, we do a teaming meeting with the children as well, and ask them certain questions around who are the people who are important in your life? Who do you have relationships with? Because what we've discovered is that plucking a child out of a home, placing them with a resource or foster parent is a safety net, but that's traumatic in and of itself for that child, because they don't know those people, etc. Still love our foster families, still love our resource parents. We need them, but this is an extra arm that we have to try to determine who might be a kinship provider, and they change the definition of kin, which means that it doesn't have to be a relative necessarily. There's all kinds of things I could talk about that, how that's vetted, what we do. But the overarching idea is that if you have a child in your circle, family or otherwise, that you may be a support to, reach out to us and we can work with you to help you get certified to help and support that family if that's something that you'd be interested in. So I think that's it for me, unless there's any questions. Thank you.
I also want to mention real quick, AHS is going to be at the Harvest Hub event. We run everyone through their screening as well to make sure that all the benefits are up to date for people that need help, and they can assist them directly during that event.
Yes, thank you. That's been a great partnership. Shelley is great about reaching out and saying, hey, we're doing this. Is this something you can come over and help us out with? So things that we don't think of, and it's great to have those communications and conversations and work together. So thank you again. That's all.
Anyone else online or in the audience? Okay. If not, the next meeting is September 25th. We will adjourn the meeting today. Thank you all for coming.
I'm hurting my